All right, thanks everyone. Hello and welcome to the National Council of Urban Indian Health's Peer-to-Peer Solutions Center on UIO HIT technical assistance support, focusing specifically on care design, the importance of categorization and EHRs. My name is Tiffani Stark and I am one of NACUI's public health program managers, and I'll be your host today. We would like to thank you for volunteering your time to participate in today's discussion. We at NACUI appreciate your willingness to share your UIO experiences with your HIT and EHRs. We do understand that this could be a sensitive yet very important topic, specifically during a pandemic such as this, but this is a safe place to feel free to share as much as you feel comfortable sharing. There are no right or wrong answers, and we know everyone's in a different place with capacity regarding HIT and EHRs. So this is a chance for all of us to learn from one another. So again, we're very pleased that you could join us today. Your feedback is very important and will allow us to further understand your HIT and electronic health record needs and how to better support them. If you do have any IT difficulty during this call, please chat directly to Comms and Events, and Lamar will further assist you. And finally, if you could, please enter in your name, UIO, or external organization, and any tribal affiliations into the chat box. That way we get to know each other while also counting your attendance. And then just some quick housekeeping items. So we would like to have the video capability on, so enable your camera. This will help with the more interactive environment. And also please note that the microphones are currently muted, but you will have an opportunity during the open discussion for any questions to be answered. And also you can raise your hand at the bottom if you'd like to be called on, or just unmute if there's any silence and pop in. Our chat box will be monitored as well, so please feel free to drop any questions along the way, and we will get to those at the designated time. And just a quick reminder, you did see it pop up on the screen, but this session will be recorded for educational and quality improvement purposes. And then we do have our evaluation reminder up on the screen, both the link and the QR code. So if you wanted to take out your cell phone and just quickly scan that and have that ready, that feedback will definitely help us with the materials to better support you. And we have a quick acknowledgement. This project is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services as part of a financial assistance award totaling $100,000, with 100% funded by CDC and HHS. The contents are those of the authors and do not necessarily represent the official views of nor an endorsement by CDC or HHS or the US government. And then we do have a quick about NACUI for any new folks that are joining us today. So the National Council of Urban Indian Health, or NACUI as we like to say, is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NACUI is the only national representative of the 41 Title V Urban Indian Organizations, or UIOs, under the Indian Health Service in the Indian Health Care Improvement Act, or ICHIA. NACUI strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas, supported by quality health care centers. And as we take a quick look at the agenda, we do have a fun little Kahoot activity to get everyone ready for the session. And then we will move into our lecture and then an open discussion with our subject matter expert, James Spillane. And then we'll move into the NACUI upcoming events, funding opportunities, evaluation, and wrap up. So now we will start off with our Kahoot activity. So we will have the screen pulled up with the information on how to log into that. Just 1 second. All right, so we do have the link and also the QR code up at the top with the game pin of 3540796. We'll just give it a couple more seconds for folks to join that want to play. Alrighty, we can get started. All right, the first, did you have breakfast today? We have yes, of course, no, more of a lunch person, or does coffee count? So it looks like the majority did have breakfast today. That is good. Great jump start to the day. All right, the big debate, hot coffee or iced coffee? Or does it depend on the season? Oh, we have a good split. Although the majority is hot coffee, and we do have 3 for iced coffee, and then 1 person for depends on the season. All right, so now moving into the EHR focus, rate your level of confidence with your EHR system. We have beginner, intermediate, advanced, or expert. Okay, we do have a bunch of different levels. So we have beginner at 40%, intermediate 20, advanced at 20%, and expert at 20%. Awesome. And the last question, so with that, what would help increase your confidence level with your EHR system? Some more trainings, more hands-on activity with the EHR, or developing and creating SOPs? Oh, wow, awesome. So we do have 50% of folks saying more hands-on activity with the EHR, then it would be more trainings and also developing and creating SOPs. So thanks everyone for playing. Now we'll just segue back to the PowerPoint. There we go. So at this point, we would like to introduce James Spillane, our subject matter expert. So James is the CEO of Health IQ. He has extensive knowledge in leveraging health IT and electronic health records. And he has also trained with the Institute for Healthcare Improvement as an advisor. James employs system thinking and design approaches to ensure quality delivery of care. So I will pass it over to James.
Hi, yeah, it's always weird looking at the younger version of me. On that. I gotta change it up and put an older picture of me on there. All right, well, this is really cool. I'm glad to be here. Thanks for getting me out of work and get to do the fun presentation, which is always better than going in the trenches. So my name is James Spillane. I'm a quality improvement advisor as a job title, I guess you would say. But basically, I work with healthcare systems all around our country in both tribal, federal, and in urban settings. So I go from the smallest clinics to the biggest clinics, and I see like what can we improve. So I'm always looking at the systems that I'm looking at. I'm always doing what today's topic is I'm trying to break it down into like chunks. I'm trying to break it down into pieces that we can focus on, that we can optimize throughout the system. Next slide. So basically, we're using categories to improve healthcare. So I'm going to show you some examples, and you probably don't realize this, but we do it all the time in everything we do. We're constantly breaking things down, whether it's your dresser drawer and you're putting socks in one drawer and whatever, we're always breaking things down. But I'm going to kind of ask you guys to just take a look at your healthcare system and see, yeah, how can we maybe break this down better? So that's what we're going to be talking about in different levels of that. Next slide. So taxonomies is one thing that you guys are going to hear me talk about. GIPR measurements and quality. How do we break these down? I mean, a lot of times we're trying to drink from a fire hose, right? And it's like, no, we can do this a different way. Let's break these things down and have areas of focus throughout the year per se. And that's where we talk about disease and domain, system and care team design, medications, empanelment, lab, RX, specialty, design for services, and what I do a lot of, process mapping. How do you break down processes and see if there's actual processes we can like remove or make it more efficient. Next slide. All right. So probably one of the first ones you hear about, or you've heard the word taxonomies, right? So we have things broken down into taxonomies a lot in healthcare, particularly because we have a gazillion ICD-10 codes and CPT codes and all these labs and all these medications. So we like to break things down into taxonomies. One of the taxonomies you'll hear about is the GIPR taxonomy, right? So GIPR is kind of unique, especially if you're like in an RPMS system or even like a next gen or something like that. You have to basically say, this is what I wanted to pull out. And where a lot of sites we can optimize at a lot of sites is a lot of times they'll change out a lab test and put a new lab test in, but their EHR is still looking for the old lab test. So we have to be going in and managing those taxonomies. So for example, we've gone to a site where they had the wrong Hep C and the wrong chlamydia test in their taxonomies. We went in and put the new current one that the lab tech put in. And then all of a sudden, all of our measures increased by like 40 to 50%. So that's the first area. When we hear these words taxonomies, you kind of want to take a look. So here's an example of strep tests. We have DGP is just another word for GIPR. You have fecal occults, you have estimated GFR, HIV. Make sure those are updated. So when you guys go back to your EHR, say, hey, do we even have the right taxonomies in the right places? So when we pull our reports, we're getting credit for the work that we're doing. Next slide. All right, so here's an example of taxonomies, if you will, or what we would call domains. If you look at your GIPR measures, I really like the GIPR measures because I believe that if we can meet the GIPR measures, we're doing good healthcare. And the reason I say that is it covers a wide range of disease, right? So we look at it here, you have diabetes up top, then you have dental, followed by immunizations, followed by cancer, followed by behavioral health. And then we go down into heart disease, STDs, breastfeeding rates, screening for brief intervention or treatment or referral. And then we go down to antidepressant medication. So we're covering a swath of healthcare. So if we can do good and meet these, we're pretty much sure that we're providing good healthcare. So that's an example of how it's broken down. And if you go to the next slide, please. So you might say, well, that's a lot to try to improve. Well, not if we do it in chunks, right? So if we categorize this and we kind of match it up with national measures or worldwide events that are happening, we can actually do this. So here's what we call measure of the month, or MOM. And it's still kind of the same, changed a little bit, but this is from Alaska. This is an example of the 2013-2014 year when we had our measures were all lined up, and you can see we have domains, and then we have it broken down by month, and then we have what measures we're measuring, and then on the right-hand side, why are we doing it? So obviously, if you're thinking about, if we're designing a healthcare system, what am I going to do in, probably the August/September timeframe? We're probably going to be doing a lot of sports exams for going back to school. We're probably going to make sure all our kids have immunizations because it's required. So I'm going to actually design my healthcare system around that. Do we have the immunizations? Are we ready? Do we have the sheets ready? Do we have the sports exams, things in the rooms ready to go? Do we have the staff to cover that? Is everything lined up? And then we focus on that. We measure it and we look at it. And we give feedback to the staff. Oh yeah, we did 150 shots this week, stuff like that. So we're breaking this down into bite-sized pieces. Of course, in October, when you go out and you watch an NFL game and everybody has like pink cleats on, that's going to be Breast Cancer Awareness Month. So let's focus on our cancer screens at that time frame. So here's an example that if we go through this throughout the year with these focal points in our healthcare systems, by the end of the year, we should meet our GIPRA measures. And that's kind of the point of doing this, bite-sized pieces. Next slide. All right, so we're going to talk a little bit about care system design. And some places I go, they are all out of whack. And some places I go, oh my gosh, this is so genius. Why didn't I think of that before? And you'll see this, and I want you guys to really think about this. So I'll go into I know you're smaller clinics and you're not a full-blown hospital gigantic system, but I'm just going to give you some examples real quick. So let's go to the next slide. So for example, you're going to want things like your emergency room probably close to where X-ray is, because you're going to have people coming in all day long, banged up, like my son after he goes skiing, and he's going to need an X-ray and see if that bone is broken. You're going to have ICU close to operating rooms. If you think about it, that makes a lot of sense. You're going to have you're going to have OB next to GYN, simple. And then you're going to have, if you have a NICU, you're going to have it close to that, or you're going to be close proximity to where that is going to be. So I've actually seen places with a lot of the OB GYN, they relocate to be closer to NICUs and stuff like that. Inpatient units are going to be close to other things that you need, like lab and pharmacy and stuff like that. Next slide. So you're going to have outpatient. You're going to want that to be close to registration, or looking at those things like, do you have Medicaid and stuff like that. Oncology is going to be close to radiation. Physical therapy, occupational therapy, rehabilitation are almost always cohabitated, sometimes off-site or in a different place, but they're mostly together. And then you also got to look at it from the patient's point of view, because we are patient-centered medical home models. So you're going to want to have cafeterias or your Starbucks close to the waiting area, or your barista or whatever. You're going to have these in centralized areas so patients can access them quite easily. Next slide. All right, so now we're kind of going you're going from the big, and now we're going to kind of come back to the small. And we all know the importance of a multidisciplinary care team. But when we talk about grouping people together, you'll hear these words like pods and care team, stuff like that. It really is, at the end of the day, for communication and efficiency. And it's incredible if you actually dig in and look at the stats on how much more efficient a care team is when they work together. In terms of communication is increased. You have a case manager support individual talking about, did Joe show up? And then someone hears that over, down, 2 chairs down, and they turn around and say, yeah, no, we already got that appointment. all this weird stuff where we create waste in the system, when you get everybody together in a care team setting, it actually increases the communication and efficiency of your healthcare. So here we have people broken up. You have certified medical assistant, you have coverage mid-level, you have a behavioral health consultant, a dietitian, a primary care provider, and an RN case manager. So whatever patient is coming into this healthcare system, they are getting taken care of at the highest level. So again, looking at categories, how do you break it down? The most important thing about this slide, though, is this is well thought out in terms of job roles and responsibilities. These people all have specific roles that they do to make sure and ensure that we have the best care that we're delivering to our patient customers. Next slide. So process mapping. So if you're an improvement advisor such as myself, you do this constantly. We just did this for working in a next gen EHR here, and we were talking about how do you do orders and how do you task the care coordinators and what happens if you forget to task the coordinators. So anyways, here's an example of a fast track. So you're breaking down your workflow. That's what this is at the end of the day. You're breaking down workflow, right? So patient enters the building. Is there an availability with the primary care provider? Yes. Well, you're going to go see the primary care provider. No, you're going to go to fast track. Do they meet the standards? Yes. You're going to go into the schedule. It's going to be register, first come, first serve, and then you room the patient, and then can the provider treat? Yes, no. So you see what I'm saying here? You're going to break it down. You're going to look at, or is this an emergency? And send them to an emergency. So kind of look at your systems, because this will actually help you figure out, is this a necessary step or is this not a necessary step? Can we remove a step? For example, yesterday, I'm here in Arizona at Gila River. We were talking about like, well, here's the process where we normally go, where if we say we order a referral, the patient, it has to go to another department, like the finance department, and say, okay, we're going to get this care. But if we see that the patient, we broke it down, and we can see if the patient in our EHR is already on Medicaid, Medicare, why don't we just get the appointment right there in the room? By breaking this down, we were able to create an efficiency, which we sped the process up, and the patient didn't have to wait a week later for a phone call. Next slide. So here's some examples of categories, like how do you categorize healthcare and what does it look like in your EHR? What does it look like on the floor? What does it look like in general healthcare life? And by the way, that's a category 5 hurricane. Next slide. So here's what we have, like I don't know what we would call this. We're going to talk about pick lists and all that later. But if you look at a little bit more mature EHRs, they'll break things down by like disease and domain, mostly. Like you'll have like a whole section on diabetes. You'll have a whole section on cardiovascular disease or blood thinners and stuff like that, statins. What we're doing here is we're just trying to be more efficient. We're not going in and typing and searching and looking for medications. What we're doing is we're doing quick, click it, boom, medications ordered. Think about that for everything. Think about that for labs. Think about that for medications. Think about that for educations. Like if you name it, we can categorize it and we can make it faster and more efficient. Next slide. Here's one. So this was at Little Traverse Bay Band, and they had a nutritionist dietitian there. And she asked me, James, these are the ones I do over and over again. Can you make me my own educational pick list? So rather her go in and go add, select, 2 minutes, good understanding, blah, blah, blah. She could go boom, 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 pick them all at once. And then she'll just say 20 minutes and it will divide the time up evenly amongst those educations. So this is saving, 20, 30 clicks in her life, which is important. So next slide. So here's an example of behavioral health, right? So they have this broken down into therapies. So this is their super bill, and they basically have to pick their E&M code at this moment in time. So they're like, this is what I do over and over again. I don't want to be searching for this. Can you make a quick drawer so we can just put it all in there and then select it? So that's what we did. So we have, sometimes you'll have group therapy. Sometimes you have a 30-minute session. Sometimes you have a 60-minute session. Sometimes it's chemical dependency. Sometimes it's alcohol, substance abuse. That's what this is exactly. So this is creating groups for behavioral health, if you will. Next slide. This one is a problem list. So this is the behavioral health pick list. This is actually a huge one. This is the one that kind of comes canned out of the EHR box. But what we have here is basically all the behavioral health things. So the provider can go in quite quickly and pick the diagnosis and get on with the visit, because you're going to need to start your visit with that. Next slide. So this one is pretty interesting. This used to be the old way how we would enter, historical procedures. So we would have to go in, we'd have to select, okay, I'm going to search for a CPT code. Of course, I don't know the CPT code. I'm going to have to make sure all the check boxes are, clicked correctly. And then I'm going to go search for a memo. And then I'm going to search for which type of memo it is. The problem is our CPT codes have rapidly expanded and our ICD-10 codes have rapidly expanded. So basically half the time you're trying to find a needle in the haystack. So if there's any way that we can make that faster and make it quicker for our providers and our care teams, we're going to do it. So this is another example of categorizing. So that's the old way. Let's go to the next slide. This is the new way. So we just say, go. We're going to add this historical procedure, and these are the ones we do over and over again. And also, by the way, these are also our GIPR measures. So we can annotate that the patient, we call these ask questions. Hey, our records show that you're due for a mammo. Oh, I've already had one. Oh, when did you have it? I had one 2 years ago at Providence Hospital. Okay, and then you go in and you add that here, and we actually get the GIPR credit for that. Next slide. Here's an example, and you guys all know this one, and you probably lived in this world for the last couple of years and will be still living in it for a while here. Here's the vaccinations, right? So we created COVID-19 pick list, and we put all the vaccinations in there. So is it the first dose? Is it the second dose? Is it the third dose? Is it the booster? Is it the second booster? Is it Moderna? We put this in a quick grab drawer for our providers to quickly select and get on with their meetings. All right, next slide. All right, this one's pretty cool. This is the adolescent care unit. So a lot of you guys are not going to have an adolescent care unit, but I just wanted to take a screenshot of it because I was just at a site that did. And they had very special groupings of what they were doing with their patients. So I'm like, let me take a screenshot of that. That's pretty cool. So I just wanted to show you that you can break it down. Like you could have one for podiatry, you could have one for diabetes, one for nutrition. How can we break down our healthcare system and make it quicker, easier, and more proficient? Because everybody, I don't care what EHR you're on, you're going to hear somebody in your place complaining about how long it takes to document. So anytime we can do this faster, it's going to benefit all of us. Next slide. This one's really blurry. Sorry about that. But this is an example of an electronic health record where they said, these are things we do over and over again. Can we create an automatic template that pulls into the EHR when we select it? So it's hard to see, but the top one right here. So let's say if I pick sports exam, right? Or wound care is another good example. I pick wound care. Most of the time, the visit instructions, the goals, and the care plan are going to be a lot, similar or the same. So, these things that you do over and over again. So they literally picked a template that every time you click it, it will automatically put this note into your notes, right? Into the care plan. So the visit instructions might be something like, change dressing at twice a day, clean, disinfect, and then stuff like that. And then follow up and care plan might be to come back every week and, check on that wound, for example. So this is them making this maximum efficient to where they just do a couple of clicks and you already have a whole entire progress note by using categorization. Next slide. All right, so at the end of the day, we even in our healthcare system itself is broken down this way, but one of the main reasons why we impanel patients, and you probably heard me say this over and over again, like in real estate, it's location, location, location. In healthcare, it's relationships, relationships, relationships. The efficiency of a healthcare system really depends on how well you know your patient and how well they're going to listen to you and follow the care plan and the treatment plan that you've set forth, right? So you're going to know that this person doesn't like this. You're just creating this effective relationship. if you impanel your patients. So we're going to talk a little bit about empanelment, but next slide. The main reason you impanel, though, is because it's manageable, right? So you can't take care of 5,000 patients. You can't take care of the problem list of 7,000 patients or whatever your population size, whether 1,000 to whatever. So what we do is we break it down into bite-sized pieces. Then we can go in and we can say, okay, show me all the people who are due for a colonoscopy. Show me all the people who are due for a PAP. Show me all the people who are due for a mammo. And we start to pull ourselves slowly out of this reactive healthcare system, and we start to become a proactive healthcare system. We're sending out letters, or we're sending out texts, or making phone calls, and we're getting those patients into our doors. So it's all about how do you take care of the patients who are outside your doors. So that's one of the main and most effective tools we have in our arsenal is empanelment. Again, you're breaking down your population into categories. So let's think about maybe all the diabetics should go over here with the diabetes person and the nutritionist over here. And then maybe we should have these people with the foot, they should be empaneled to the podiatrist or something like that. So look at your healthcare system and how can we break it down and then better serve our people. Next slide. So this, if you're an improvement advisor such as myself, this is kind of like the big book, if you will, that the improvement guide, and pretty much every advisor has one of these. Anybody who's kind of in quality improvement. So if you're interested in quality improvement, you might want to get this book. And I've actually worked with Gerald a lot, and Norman and Lloyd. These are all pretty effective. These people work with Toyota, and actually one of them is right over here right now. I'm right next to the Intel plant. He's doing advisory work with Intel. So we just went out and had coffee. So these guys know what they're talking about when it comes to system designs. So I'm going to talk a little bit about this, but in this book, there's a section, it's about maybe a 100-page section, which talks about change concepts and stuff like that. So I'm going to kind of go and show you some of that and what it looks like. And I'm going to kind of give you a higher level understanding of some of this stuff. So next slide. So this one right here is, I can't see the top of it. Hold on. Let me see if I can move this. No, I can't. All right. So match amount to need. So this is really important because what you're going to, if you think about supply and demand and you think about these things, again, let's say it's the beginning of a school year, you're going to be doing more, immunizations to get those kids back into school because it's required at school per se, or kids are going to want to play, soccer. So you're going to have to do a sports exam. So what we're going to do is we might ramp up staff to match that. So how are we going to do that? We're going to look at our EHRs, we're going to run numbers, and we're going to try to figure out what's going on. But also you got to think about when is the busiest time in your health clinics? Do you guys know the busiest time in your health clinics? I've worked for a dental practice, and the busiest time was always Friday, because what would happen is someone would have a toothache. They'd be like, I don't want to go in. I don't want to go in. I don't want to go in, because people don't want to see a dentist. And then Friday would come around and they'd go, I'm going to have to wait all weekend. What if this gets worse? I'm going to go get this checked out. They go in, they get amoxicillin or something like that, and they're on their way. So really take a look at even your supply. So we're talking about logistics and stuff like that here. Look at your supply and how much do you have, and match it to the need and the demand. And we'll talk a little bit more about that. Next slide. So it's about balance, right? That's what we're talking about. I always thought this picture was a little funny, little girl. So here's it. No, that's perfect. You read my mind. That's perfect. All right. So this is a picture I drew one day on a board to kind of explain it to the Kenichi tribe. I was working with them at the time in Kenai, Alaska. Beautiful place, by the way. Go there if you ever get the chance. If your supply and demand is unequal, this is like an equation or something, right? You can now predict what's going to go on. So if your supply and demand is unequal, meaning you have 60 patients who want to be seen, but you only have 30 slots, your third next available appointments or your next available appointments are going to go up, right? That means your no-shows are going to go up. Did not keep appointment, that's your DINKA rates. That's going to go up, because if you're scheduling a patient with a cold for 2 weeks out, what do you think happens to that cold? It goes away, but they're also going to schedule that appointment because it's, loss aversion, meaning they just because it's being offered, they're going to take it because it's rare, right? So they won't show up to that appointment. And when we have that happening in the healthcare system, you're going to have your satisfaction go down for both staff and for the patients. So this equation is very simple. Match your supply to your demand. And how do we do that? We break it down and we find out when are our busy days, when is not our busy days. Next slide. Here's another one. Let's see. Design and redesign product. Let me see. Decentralize. Oh yeah, sort products into grades. All right, so that's what I'm looking for. Sorry, I can only, when I'm in my Kindle, I can only take a picture and like it will do the whole thing for some reason. So what we're looking at is 56 here. Sort product into grades. Well, we kind of do this intuitively in our healthcare systems, right? We're like, well, that's an emergency. You need to go to the emergency room. Oh, that's nothing big. Why don't you go over here to the fast track clinic and we'll just go get those meds refilled for you. Oh, you're coming in here for your diabetes and we need to do an A1C. You need to see your primary care provider. So how can we break things down in our healthcare clinics like that? You're coming in only for a billing thing. You go over to the financial department, et cetera. So look at your healthcare system. Can we work more efficiently? Don't try to wear all the hats. Sometimes, especially in urbans, you kind of are forced to wear all the hats. You're kind of forced to do like everything. But if we can, let's break it down a little bit. And so you specialize in this, you specialize in this, and you specialize in that. Next slide. Here's an example of what I was talking about, grades, in terms of here is Nome, Alaska. And in Nome, Alaska, they have a fast track clinic. And the patient, the thing about this, what's so good is the patient sees these signs and they themselves can self-select where they need to go. So if you need to go to primary care, you're probably going there for a visit for more chronic things, annual exams, tuberculosis evaluation, obstetric, stuff like that. You're going to go over here. If you have a sore throat, an earache, a headache, infection, or something like that, you're going to want to go to the fast track clinic. And then if you have difficulty breathing, if you have broken bones, of course, the big open wound, you're going to probably want to head to the ER. But very simple, break down your healthcare into disciplines and into different categories, strategize this a little bit. All right, next slide. All right. So we're adjusting to peak demand, right? So again, we spoke a little bit about this. This goes into gives you examples. So if you read through this slide deck, or if you ever get a chance to read through this, this is all pretty good stuff. But again, this goes back to like what we're talking about in the dental clinics, where we know that we're going to be slammed on Fridays, right? So think about your organization and really think about peak demand, but also think about this for meetings, right? Sometimes we do meetings at our busiest times. No, we're going to want to look at when is our downtime. And that's when so certain places I work with, we establish that. So for example, the Intertribal Councils of Michigan established that the slowest day of the week is Wednesday. So we have our meetings on Wednesday, our Michigan meetings. I work with Fort Defiance, and Thursdays, they have their provider meetings. It's their downtime. And then right after that, they have the patient-centered medical home model meeting. Why? Because hardly anyone comes in on Thursdays in the morning. So design your system not only for meetings, but for staffing for peak demand. Next slide. Here's the old way we used to do this. So we would literally do a supply and demand count. And how you would do that is to find out your demand is what you would do is take the top row, provider A. So everybody who is already in your schedule, so you have 10 patients scheduled, right now we have a demand of 10. Now, if a patient calls for an appointment, that counts, regardless of when you scheduled the report. And then if a patient walks in, that counts. And a lot of what you'll find out is you're not meeting the supply and demand. You're not basically supplying enough visits. So if you have if 15 to 20 patients want an appointment today and only 10 can get in, you're going to start to see backlog, and you're going to start to see that third next available appointment go out, which means your no-show rates will go out and stuff like that. But now we have these new EHRs, and we can quickly do these counts and figure out exactly what our supply and demand is. So a lot of times this means just hiring another person and spinning that up. Next slide. This one, use proper measurements. So a lot of times I see places measuring things and they're the wrong things. Really take a look at what you're measuring, what you're focusing on, because people perform to the measurement. And there's a great example, I think, in here about cesarean sections, right? So if you measure that, you can reduce the cesarean sections that you have. We can look at different things in our healthcare system, but what matters? What's the disparity that we have in our community? So when I work here at Gila River, their #1 disparity is diabetes. So we focus on diabetes and we make those measurements loud and pronounced. And this is what we're focusing on. We're creating feedback loops with the patients and feedback loops with the staff. So they are all on top of it. When I work at Fort Defiance, their #1 issue is access. So we're looking heavily at transportation. We're looking heavily at, this is rural healthcare. So how do we better the access? Next slide. All right. And then give people access to information. I do not know. I think it's because we live in such a private information sector and such a HIPAA section that we think all information is no, we can't share anything. We can't, no, there are things that we can share. And a lot of that is our quality measures. And when I mean like not only giving your providers the access and giving your staff the access to how well we're doing like on our GIPR measurements or something like that, or our patient satisfaction scores or whatever, but also give the public that. So at really slick sites that I go to, they have their measurements on the wall in the lobby. They're like, here's how well we're doing, and here's what we're not good at, and here's so you're informing the patient, oh, that's why they're doing this initiative. They're working on this measurement because it's actually low and they want to increase it and be better at it. Next slide. So here's one. This one's the caveat, if you will, of we're talking about breaking things down. We're talking about categorizing. We're talking about taxonomies, but sometimes we can go a little nuts, right? So what we'll do is we're over complexity. We'll make too much, right? So reduce classification. So this example here, if you were to read this was like a gas industry, like a fuel industry that created too many classifications of their grades. So what that meant is they put more complexity into the system. So you had to have, 87 gas and 92 gas and blah, 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 blah. And then that means all of their stations had to do that, which means they had to upgrade all. It just created too much complexity. That's why when you go to a gas station, you have 3 grades of gasoline. Look at your systems and make sure we're not over complicating them. And can we actually reduce some of our categories, stuff like that? Next slide. All right. So according to ChatGPT, in summary, taxonomies play a vital role in healthcare and promoting and standardization, improving data, organization, and management, supporting clinical decision-making, facilitating billing and reimbursement, advancing research and development, and informing public health policies, and driving quality improvement initiatives. Next slide. And that's it. That's a wrap. That's categorizing for healthcare. Thank you very much.
Thanks, James. So now we'll move into our open discussion where, if you have any questions for James on what he presented, any comments, anything that came up during the presentation, now is your time. But I did want to mention, just to jumpstart, when you were presenting on, staffing and how that's often a challenge in our communities. So how would you spread out tasks or roles when staffing is limited? Like, how would you start to tackle that?
That's very good. Actually, down here in Arizona, I was listening to NPR the other day, and as I'm just driving, it's just the radio station on the thing. I'm driving to work, and they were talking about how the state itself is having a problem with pay. Right? They're pretty much on every single thing, whether it's the DMV or the Department of Transportation or their infrastructures they're about $10,000 below national average. So they can't hire these positions because a lot of times somebody I can go work at a restaurant, make more money than I would work here, right? So so what if we kind of tied into the subject matter that we're talking about today, it's kind of really important that we're doing the most essential things that we need to do. So really look at your organization and break it down and try to eliminate all the rest of it, the waste, right? So if you're in a place, we know like here where we have diabetes as an issue, we're going to make sure we staff that and we keep it hit. And then we're going to like kind of look at things like, hey, are we really doing this child development motor skills thing, or can someone else do that, or can we outsource that? So what can you outsource a lot of times? If you're having, think of it that way. What can we can't afford to do this, we outsource it. So.
Awesome, thank you. I'll give it a few more seconds to see if there's any questions or any other ideas that sparked from the presentation. Then I also had to kind of build off of that because now it had me thinking. So what's the best way to overcome the overclassifying that you were getting at to help make the processes more leaner, I guess you would say?
Well, yeah, that's a really good question. Sometimes so the first thing you got to do is approach a healthcare system like a patient, right? And like I'm working with one site who has a brochure for everything. And so they have a brochure for what is the patient-centered medical home. They have a brochure on what primary care is. They have a brochure on what RCM, revenue cycle management is. They have a brochure on purchase and referred care. As a patient walking through the doors, that's too much noise. That's too much information saturation, right? So it's the same thing. If you're a patient and you're walking into a healthcare facility and you just want to see a doctor, that's all you know, right? You don't know like what's the difference between inpatient and outpatient and fast track and all this stuff. So sometimes you have to just keep it simple and then look at what does the patient really want? They want to see their care team. They want to see the primary care provider. So don't overdo it. Oh, you have to go to, no, that's special. You have to go over here to the immunization department, or you have to go, how can we house those in one central location? So centralization, I guess you would be. So you centralize everybody like that, like a care team, and multidisciplinary. So this is primary care, and we offer all these services here. You can get a lab in here, you can get a shot in here, you can get stitches in here, you can get everything here. That's how I look at it. Sometimes people break it up too much, and then the patient gets confused as they're walking through the maze of healthcare, if you will.
Yes, great. Thank you so much.
So long story short, centralization.
Just double checking the chat box. I did see that Micah put in the chat box. If there's any questions or comments, you could put them in the chat box or come off mute. And then she also shared the evaluation link, which is also on our open discussion slide.
Yeah, and I really hope the goal for today was to really kind of take a higher view of your healthcare system and like, hey, can we look at it this way? And can we break things down differently, be more effective? So I really hope that stuck with some of you folks out there.
Yeah. Give it a few more seconds. We do have a comment from Stephanie. Stephanie said she appreciates the webinar, so thank you, Stephanie. But no worries, if there's anything, any other questions that pop up, we'll be checking the chat box as we move through the concluding slides. So no worries, we'll keep checking. The next slide. So we do want to provide the reminder about our NCUI technical assistance requests for the one-on-one time. So in addition to this amazing opportunity to have everybody together in one space, we also have that one-on-one time available. So you can go to ncui.org/TA and fill out that. We have HIT on there. There's GIPRA, any type of assistance that you may need. Just put that in the request and that will come to us. And then we also have our upcoming NACUI events. So we do have a number of them. We have the Growing a Sustainable Workforce on the 19th. On the 26th, we have the STI Community of Learning. On April 27th, we have the Journey of Healing Domestic Violence 101, and that's for the MMIP project. And then also we have our NACUI annual conference, May 15th through the 18th. And I do want to mention we have an exciting opportunity for our UIOs to be a part of a panel that is all about EHRs. Costs, upgrades, pros and cons for your EHR during this conference. So if you're interested in becoming a panelist, definitely drop your email in the chat box or send me an email, and I'll provide more information, and we can also schedule a call to discuss that further. And then looking forward to June 8th, we have branching out wellness programming for patient-centered HIV care from an urban Indian perspective. And then for the NACUI funding opportunities, we have the electronic case reporting, a UIO subgrant award for year 2. So this is on a rolling basis, and the award is up to $84,600. And we do have the link for the application listed as well as the QR code. And you can also email me, call me for any questions or any additional information that's needed. And again, I just want to thank everyone for taking the time to join us today for this session. And thank you, James, for all of the information that you provided. And in the meantime, if you have some time to fill out the evaluation, we would greatly appreciate that as well. That definitely helps us better, provide information to you and your UIO in the future. And we'll hang on for a bit if there's any other questions or comments. But thank you again, and I hope you all have a great rest of your week.